All right. Well, this is James Lunday and Ellen Bauman from the Arc DFW area. We just finished up our first day at the Arc's Disability Policy Seminar here in Washington, D.C. We thought we'd just take a few moments to share, you know, thoughts for the day, big things, takeaways. What do you think, Ellen? What was your most memorable?
Oh, I there were several things. The self advocates and their panels were spot on, and the I guess the big elephant in the room is the new administration and the reckless cuts that we're being threatened with,
Mm-hmm.
and you know for for them it's a financial cutback, and for us it is a lifeline cut,
Mm.
and just the need to intervene somehow and help them realize the ripple effect, because Medicaid touches everything.
Right. Yeah, I know that was a big thing for me. Is I didn't realize that community-based services were an option under Medicaid. So I hadn't. I mean, obviously, I know that's a big issue, especially for us in Texas. And so, those of you that don't know, one of the things they talked about today was that under Medicaid, there's certain requirements states have to do in their Medicaid program. So, provide health care, for example. And if you're under 21, to provide sports services, for those under 21. But once you're in adulthood, well, then it's an optional program for community-based services. And so when money gets cut from states, that's what's going to be the biggest risk are those optional programs.
It and that's the most desirable. That is our goal, to get everybody living in the community with those
Mm-hmm.
supports. And here we've been working towards getting that increased,
Mm-hmm.
and now all of a sudden there's a stark reality that it might go away. So
Right.
it's
Yeah. And obviously, it's interesting here, being here with other states in the country. They're dealing with a lot different programs. They get a lot more services in their states than we do. And so it's just a different perspective. In some ways, maybe we lose less because we have less to lose, but we are at the bare bones already. And so
right,
losing anything is obviously going to be very tight.
right. We were already in a provider desert with the MCOs and that relationship we have there. Um, we were struggling to find good doctors or therapists, those sort of things. And then the other issue of the direct workforce, for our attendance and the wages there, that's the number one priority for our legislators this time.
Mm-hmm.
And I mean, just
Right.
one more thing that people with disabilities and their family have to deal with at this time. So we can't stress how important it is to tell your story, use
Right.
your voice, especially with your legislator in your
Mm.
in your area, because if they don't know, then there's certainly not much chance of it being improved. So keep those things in mind, and keep just keep speaking up, and uh, be be positive.
Right.
Be positive.
Yeah, there's a lot of things they shared today around like different potential type of cuts to the program. Right, I talked about block grants, or they call, I guess now, per capita
Mm-hmm.
limits. Um, but it still goes back to if the federal government reduces its share, which is about 60% in Texas, that the federal government reimburses, then the idea, well, the states will pick up the tab, but we know, well, the states only budget so much for Medicaid, so they're going to have to reduce somewhere, and that's why we're talking about like those um, with the optional services. But they also
Right.
talked about work requirements and how hard it is to get Medicaid services already.
Right.
And so a lot of people that have disabilities, well, they need the services in order to be employed, to be eligible for work. And so if you take away the support services, well, then they're not employable. They can't meet the work requirement. So there's a whole
Exactly.
problem around that.
Just the ability to get there, just
Right.
the transportation is that issue, and to think about the example they used of like walk, it's like walking the check.
Yep.
When you go out to a nice meal with one of your um, close friends or associates, and you order a nice meal, and you have a drink, or you have another drink, or have another drink, and then the meal comes, and then all of a sudden that person that you were sitting there with just gets up and walks out the front door,
Yeah.
and leaves you to pick up the tab. And it's a great correlation of what will happen with the states if the federal funding stops. And the crisis is, it may take a year before it all trickles
Mm-hmm.
down and the money stops, but it could also be something that people feel immediately, because if they eliminate the staff in those offices where everything is processed, and they're not able to make those monthly payments, um, then we people could be desperate sooner than later.
Right. Yeah, and this is a big week. The Senate just passed its reconciliation bill this last weekend, so that kicks it back over to the House. Will they take the Senate's version or not? So a lot of this has been set up to kind of funnel through with limited. With they only need 50 senators to approve that. So it's a unfortunately relatively common mechanism to get big stuff passed, and so there's a lot tied to tax cuts and then these savings that the Energy and Commerce Committees, been guided, I guess, or directed to make cuts. I mean, that was one of the things about. So 880 billion over 10 years. If you take everything other than Medicaid out of the Energy and Commerce's purview, that's 135 billion. So that means, okay, there's got to be another 750 billion that the only thing left to money come from is Medicaid. So sure, that's over 10 years, but that's $75 billion a year of funding out of there. So,
and the other thing I wonder about is, has no one thought about what that's going to do to our unemployment rate? It'll skyrocket if they shut down all these agencies and let go of all these critical staff members.
Right.
I mean, these are not just somebody that we could do without.
Yeah, and that was the other thing. Like, today we talked about, well, we're not going to cut. Everyone on the Hill will say, well, we're not going to cut services for people with disabilities. They need it. But a lot of people that have disabilities don't qualify under the Social Security rules as having a disability. So they're picked up in Medicaid expansion. Obviously, Texas hasn't done Medicaid expansion, so we're not at risk from that perspective, but we are risk. There's other mechanisms that they're trying to save money from, and it affects the whole apparatus around services to people with disabilities. So there's a lot of that. Beyond Medicaid, we did talk about education and the challenges, obviously, with the Department of Education cuts there, and civil rights enforcement. We know Texas doesn't have the best record of supporting people with disabilities in the educational system. There's been a long history with that. So the idea of less oversight is not very favorable either. So with all that, well, we just want to take a few minutes to recap the day. So it is Monday, and that means Call to Action Monday here at the Arc DFW. So there is going to be voting this week on the budget bill and these cuts. So encourage you, reach back out to your representatives, reach back out to your senators. Cornyn and Cruz. We're actually on the slate to meet, go to their offices on Wednesday. So we'll be doing that here, but we need you guys at home to do your part as well. And so we hope we'll do that, and tune back in tomorrow for some more updates from the conference.
Thanks so much.
Yeah.